Hello and welcome to Natural Health, the channel where we explore the benefits of natural remedies for various health conditions. In today's video, we are going to talk about blood clotting, a serious problem that can lead to heart attacks, strokes, and other complications. Blood clotting is the process by which blood cells stick together to form a plug that stops bleeding. However, sometimes blood clots can form in places where they are not needed, such as in the arteries or veins. This can block the blood flow and cause damage to the organs or tissues. Blood clots can be caused by many factors, such as injuries, infections, inflammation, smoking, obesity, diabetes, high blood pressure, high cholesterol, and certain medications. Some people may also have genetic conditions that make them more prone to blood clotting. The symptoms of blood clots depend on where they are located, but they may include pain, swelling, redness, warmth, numbness, tingling, weakness, difficulty breathing, chest pain, and loss of consciousness. If you suspect that you have a blood clot, you should seek medical attention immediately, as it can be life-threatening. The conventional treatment for blood clots may involve medications, such as blood thinners, anti-inflammatory drugs, or clot-busting drugs, or procedures, such as surgery, angioplasty, or stent placement. However, these treatments may have side effects, such as bleeding, bruising, allergic reactions, or infections. Therefore, some people may look for natural alternatives to prevent or treat blood clots. In this video, we are going to share with you 6 herbal remedies that may help with blood clotting. These herbs have anti-inflammatory, anti-platelet, or anticoagulant properties, which means that they can reduce inflammation, prevent blood cells from sticking together, or slow down the clotting process. However, before you try any of these herbs, you should consult with your doctor, especially if you are already taking any medications, as they may interact with them. Also, you should not stop taking your prescribed medications without your doctor's approval, as this may worsen your condition. So, without further ado, let's get started with the first herb on our list. 1. Turmeric. Turmeric is a spice that is widely used in Asian cuisine, especially in curry dishes. It has a bright yellow color and a distinctive flavor. But turmeric is not only a culinary ingredient, but it is also a powerful medicinal herb that has been used for centuries in Ayurvedic and Chinese medicine. Turmeric contains a compound called curcumin, which is responsible for its anti-inflammatory, antioxidant, and anti-cancer properties. Curcumin also works as a natural blood thinner, as it can inhibit the activity of platelets, the blood cells that form clots. A 2019 review indicates that turmeric may help block blood clotting. However, it advises caution when combining turmeric with blood-thinning drugs. To use turmeric for blood clotting, you can add it to your food, drink it as a tea, or take it as a supplement. However, you should be careful not to consume too much turmeric, as it may cause stomach upset, nausea, diarrhea, or gallbladder problems. The recommended dose of turmeric is about 500 milligrams per day, but you should check with your doctor before taking it. 2. Ginger. Ginger is another spice that is commonly used in cooking, especially in Asian and Indian dishes. It has a pungent and spicy taste and a strong aroma. Ginger is also a well-known remedy for various ailments, such as nausea, indigestion, colds, and flu. Ginger has anti-inflammatory, antibacterial, and antiviral properties, which can help fight infections and boost immunity. Ginger also has blood-thinning effects, as it can reduce the production of thromboxane, a hormone that causes platelets to stick together. A 2015 literature review notes that ginger may help prevent blood clotting by reducing thromboxane. Ginger also contains salicylates, the same substances that give aspirin its blood-thinning properties. To use ginger for blood clotting, you can eat it fresh or dried, add it to your food or drinks, or take it as a supplement. However, you should not consume too much ginger, as it may cause heartburn, gas, bloating, or bleeding. The recommended dose of ginger is about 2 to 4 grams per day, but you should check with your doctor before taking it. 3. Cayenne pepper. Cayenne pepper is a type of chili pepper that is very hot and spicy. It is often used to add flavor and heat to various dishes, such as soups, stews, and sauces. Cayenne pepper is also a potent herb that has many health benefits, such as improving digestion, metabolism, circulation, and immunity. Cayenne pepper can also help with blood clotting, as it contains salicylates, just like ginger and aspirin. Some people say that including cayenne pepper in your diet can help thin your blood and prevent clots. However, reliable scientific evidence has not shown that cayenne pepper has blood-thinning qualities. To use cayenne pepper for blood clotting, you can sprinkle it on your food, drink it as a tea, or take it as a supplement. However, you should be careful not to consume too much cayenne pepper, as it may cause irritation, burning, or ulcers in your mouth, stomach, or intestines. The recommended dose of cayenne pepper is about 30 to 120 milligrams per day, but you should check with your doctor before taking it. 4. Vitamin E. Vitamin E is a fat-soluble vitamin that is found in many foods, such as vegetable oils, nuts, seeds, green leafy vegetables, and fortified cereals. Vitamin E is an essential nutrient that has antioxidant, anti-inflammatory, and immune-boosting properties. Vitamin E can also affect blood clotting in various ways, depending on how much you take. Low to moderate doses of vitamin E may help prevent blood clots by inhibiting platelet aggregation and enhancing blood vessel dilation. High doses of vitamin E may have the opposite effect by increasing the risk of bleeding and hemorrhage. The National Institutes of Health's Office of Dietary Supplements suggests that people taking blood-thinning drugs should avoid large doses of vitamin E3. It is unclear how much vitamin E thins the blood, although it is likely that people would need to take more than 400 international units, IU, per day to have a blood-thinning effect. However, long-term use of high doses, for instance above 1,500 IU daily, may have negative effects. To use vitamin E for blood clotting, you can get it from your diet, or take it as a supplement. However, you should not exceed the recommended daily intake of vitamin E, which is 15 milligrams or 22.4 IU for adults. You should also check with your doctor before taking vitamin E, especially if you are already taking blood-thinning medications. 5. Garlic. Garlic is a bulbous plant that belongs to the onion family. It has a strong smell and a pungent taste. Garlic is widely used as a flavoring agent in many cuisines, especially in Mediterranean, Asian, and Middle Eastern dishes. Garlic is also a popular remedy for various health problems, such as high blood pressure, high cholesterol, infections, and colds. Garlic has antibacterial, antiviral, antifungal, and antiparasitic properties, which can help fight off pathogens and parasites. Garlic also has blood-thinning effects, as it can inhibit platelet aggregation and fibrin formation, the two main processes involved in blood clotting. A 2016 review suggests that garlic may have a modest effect on reducing blood clotting. However, it also notes that garlic may interact with some blood-thinning drugs, such as warfarin, and increase the risk of bleeding. To use garlic for blood clotting, you can eat it raw or cooked, or take it as a supplement. However, you should not consume too much garlic, as it may cause bad breath, body odor, stomach upset, or allergic reactions. The recommended dose of garlic is about 2 to 5 grams per day, but you should check with your doctor before taking it. 6. Ginkgo biloba. Ginkgo biloba is an ancient tree that is native to China. It has fan-shaped leaves and edible seeds. Ginkgo biloba is one of the oldest and most widely used herbal medicines in the world. It has been used for thousands of years to treat various conditions, such as memory loss, dementia, depression, anxiety, and tinnitus. Ginkgo biloba has antioxidant, anti-inflammatory, and neuroprotective properties, which can help protect the brain and nervous system from damage. Ginkgo biloba also has blood-thinning effects, as it can inhibit platelet activating factor, a molecule that stimulates platelet aggregation and blood clotting. A 2017 review indicates that ginkgo biloba may have a significant effect on reducing blood clotting. However, it also warns that ginkgo biloba may interact with some blood-thinning drugs, such as aspirin, warfarin, and clopidogrel, and increase the risk of bleeding. To use ginkgo biloba for blood clotting, you can take it as a supplement, in the form of capsules, tablets, liquid extracts, or tea. However, you should not consume too much ginkgo biloba, as it may cause headaches, dizziness, nausea, diarrhea, or allergic reactions. The recommended dose of ginkgo biloba is about 120 to 240 milligrams per day, but you should check with your doctor before taking it. So, these are the 6 herbal remedies that may help with blood clotting. However, remember that these herbs are not a substitute for medical advice or treatment, and you should always consult with your doctor before using them. Also, Be aware of the possible side effects and interactions that these herbs may have, and do not exceed the recommended doses. If you have any questions or comments, please leave them below, and we will try to answer them. Thank you for watching this video, and if you liked it, please give it a thumbs up and subscribe to our channel for more natural health tips. See you next time.